yesterday. Are you able to state how many involved underlying health conditions, and if nursing homes or group homes were involved, which ones were they?
The deaths sadly announced today. 2 deaths were associated with Oak Hill. 2 deaths were associated with Riverview Nursing Home. 1 case was associated with Orchard View, and the other 2 cases were not associated with nursing homes.
What about the deaths? This is Gina Macris from Developmental Disability News. What about the death that was reported the other day of the young person in their 20s in the group home? Was that person tested, or did that person go to the hospital?
Let me share what I do know. We certainly had the test that identified the person as having a COVID-associated death. She was sadly a female in her 20s and lived in a residential program for adults with differing abilities. She passed away earlier this week and had underlying medical issues associated with her existence.
Mhm.
What else did you ask?
Was she tested while she was ill to rule out with the motivation of ruling out or ruling in COVID-19?
She did have a COVID-19 positive test return. I believe I would have to get more information if that was just prior to her passing or just after. I did have that story, but I want to make sure I give it to you properly, and I do have that it was just after she passed away.
Okay. I have submitted a bunch of questions to Joseph about that case, and I won't go on and on. But I was wondering in the future if people could, when they say nursing homes and congregate care, if they could say, factor out different kinds of congregate care in giving the statistics.
Yes, when we have enough numbers associated with a facility, we have been and will continue to differentiate and share more information about that. We previously had this as an isolated case, but now that has changed, so we certainly hear you with that.
Well, your 123 that you reported yesterday in congregate care is 100 more than was reported the previous day for group homes, and I don't know whether that's apples to apples or apples to oranges, so that's why I asked for the differentiation.
Indeed.
Okay, I'll be quiet now.
Thank you.
Dr. Alexander Scott, Christian Winther from Newport Buzz. Could you give a breakdown on those hospitalized that are in the ICU and also on vents?
Sure. We have 50 people who are in the ICU out of the 183 current hospitalizations. Among the 50 in the ICU, 36 are intubated and on a ventilator.
Thank you.
Welcome.
I asked a question earlier that the governor did answer during the press conference. This is Michael Billow from Motif. I want to apologize for the unclarity, but what I was trying to get at is that there are people out of state, New Hampshire, Massachusetts, and so on, who own things in Rhode Island, boats, houses, and they are concerned that they want to do seasonally required important maintenance on those boats and houses. And they're worried if they come into Rhode Island to do that, which they consider essentially a work obligation to maintain them, that they'll be stuck in quarantine. Now, their intention, as I understand, is to come into Rhode Island, work on the boat or house, and not be in contact with anybody, effectively be in quarantine while here, and then just leave either the same day or maybe the next day, staying no longer than a weekend.
That's fine.
But that's fine.
Okay. Yeah, the way it came up on the screen, I didn't totally follow it. Yeah, that's fine.
and I wouldn't call it work-related, but they should certainly, stay local and be quarantined if they come here and then return.
Right. So
I think what we're hearing on, I'm sorry, I didn't mean to interrupt you, Governor, I apologize.
while they're in Rhode Island, they need to abide by the stay-at-home order. But if they're going to leave after a couple of days, then fine, leave and go to whatever state they're from and obey the laws of that state.
What we're seeing on social media is that they're worried that they're going to be ordered into quarantine, made to stay 14 days in Rhode Island. I think that's sort of the weird misunderstanding.
No.
Okay.
No.
Thank you for confirming that.
Governor, this is U.S. Sherman from Channel 12. I'm wondering, in Massachusetts, the U.S. Attorney's Office has launched an investigation into the level of care that was provided at the Soldiers' Home, which obviously had a lot of deaths and cases associated with it. In Rhode Island, there's obviously been a lot of cases at nursing homes. Has there been any concern from the state as to the adequate level of care being provided to those in the nursing home?
No, not at this time, no. I mean, look, the sad reality, and you're seeing it all over the country, and I talk to governors regularly who are battling it, it's very, very difficult in the nursing home setting to keep people safe. The combination of the fact that one caregiver takes care of many people, these people are the most vulnerable. We know that seniors do the worst of the disease, and so unfortunately, like you saw what happened in Washington State, it's a very difficult thing. Having said that, if we at any time have any reason to believe that there's any kind of negligence, we will absolutely report that and investigate it and prosecute it. But we don't have any reason to believe that that's happening in Rhode Island at this point.
Dr. Nicole, I had a follow-up on contact tracing that you had mentioned earlier. I recall during the measles outbreak last year that public health alerts, at least in Massachusetts, they would say, this person visited this store, this restaurant, and so during these times on these days. Is such a similar thing happening with this contact tracing? I know that people are being told to social distance at grocery stores, but would you consider those people at stores to also be part of contact tracing? How are you finding everyone that everyone is in touch with if they don't know exactly who they're in touch with?
Right. That was part of why I explained the approach with defining direct contact. It has to be less than 6 feet of distance for longer than a 10-minute period of time. So we do collect the information about where someone has been, what type of interaction they had, the types of people they came across. We sometimes have to be creative in looking at video surveillance or other ways to see who they might have encountered. But oftentimes using that definition of less than 6 feet for a longer than 10-minute period of time rules out people like someone you pass at the grocery store because you're not in that type of direct contact with someone for that amount of time, most of the time.
Okay, thank you.
I just want to follow up on the nursing homes. This is Amanda Milkovitz at the Globe. We talked a lot about, there's a really good percentage of residents and actually healthcare workers at the nursing homes are getting sick. But I'm looking at the numbers jump in Providence, and I'm wondering if you're also seeing a cluster at any of the elderly high-rises or any of the elderly housing complexes in Providence or outside the city.
Places that we are seeing groupings of cases continue to primarily be in nursing homes or other congregate settings, nursing homes or rehab facilities that exist. And it tends to be, even in speaking to colleagues who covered the clusters of cases that occurred in Washington, they tended to see more of the clusters take place in nursing home settings compared to assisted living or some of the more independent living facilities. seniors,
Okay.
primarily because of the proximity of location between residents in a nursing home setting or living setting.
Okay, so it isn't like Carroll Towers or any of those other places that are becoming a hotspot.
Correct. We will say if we have clusters of cases there, and I believe the facilities I have in front of me are primarily nursing homes or rehab facilities or group home settings.
Okay, thank you.
Governor, this is Mary McDonald from the Providence Business News. I have a question about construction sites and manufacturing plants. Is there anyone from the state actively inspecting those locations to see if they're complying with social distancing and providing wash stations, or are we really just waiting for complaints? How are you evaluating that?
So it is a combination. We are waiting for complaints. Liz Tanner, who runs DBR, and Stefan are in proactive contact with managers and such of these operations. We're doing a limited amount of unannounced spot checking, but at this point, so we're doing those three things.
Okay.
And we have found instances where we have had to ask people to make changes.
Okay, and if I can ask a follow-up question, I got one complaint from someone who was saying that one of the manufacturers has a method for employees to check in where they actually leave a thumbprint on some kind of a device, I guess, and there's concern that they're not wiping it down. Are those the sorts of things that...
Yeah, that's a problem. Let us, not in front of everyone here, but call Jen Bogdan and let me know who that is. That's a problem.
Okay.
Governor, it's Eli Sherman.
I have a question on whether I have a question very quickly on the rules on self-quarantine from other states. If somebody, say, is shopping in Pawtucket, lives in Pawtucket and goes shopping in Seekonk, goes shopping in Attleboro, or lives in East Providence, goes shopping in Seekonk, grocery shopping or something, and just comes right back, and that's that's where they typically shop anyway. Does that subject them to a self-quarantine requirement for 14 days because they've been in Massachusetts? We've heard conflicting reports on that. This is again Michael Billow from Motif.
The answer is yes. Between now and May 8th, we have a strict interpretation of these rules, and the answer is yes. Eli,
Governor, I'm wondering, I noticed today you made another comment about the gatherings at retail big box stores, that type of thing. You've said in the past that this has been a problem as well, and I'm just wondering if people aren't heeding your orders, then at what point do you have to take action and shut them down completely?
So, who is that? Eli. In the spirit of being extremely candid and transparent, as I have been, I have a meeting this afternoon with the folks at DBR to have exactly that discussion. Because I'm getting too many reports, and frankly, going to the garden center and buying lumber and such is not essential right now. It's not in the same category as going to the pharmacy or the grocery store or the drugstore. And I'm not entirely pleased with the way things are happening at some of these big box retailers. And by the way, it's not just the fault of the retailers. Some of them are doing everything they're supposed to do because we're out there. You need to know, I've got the fire marshal going around store to store, the state police store to store. A lot of times they're checking in, and the retailers are in fact doing what we've asked them to do, but people are just kind of refusing to obey and being in large crowds in aisles and garden centers. So we're going to talk about it this weekend, and I'm going to wait to get some data, and I may make another announcement next week.
Okay, thank you.
We have time for one more question.
Well, I just want to follow up on something that I think I've been asking a lot, which is, Governor, you talk about, the surge is coming, it's ahead. but there's no real details about what exactly you're looking at. And I know that in Massachusetts, the governor has spoken about what the model is showing there. Why not tell us what you're thinking, or what at least the data is showing right now, that, how many cases we could be looking at, when the surge is going to hit, not only when it's going to hit, but how many, what the peak could be at this point?
Yeah. Look, this is a judgment call by me. We have a model. It's a model that is in development, and I want to get some more data, actual data of our experience in Rhode Island, so I have a higher degree of confidence in the model before I release anything to the public, because there are consequences to putting something out that I think isn't as accurate as it could be. And at this point, I'm just have decided not to do that. But I can tell everyone, it's more important, I think, for the public right now to obey the stay-at-home order. If they do obey the stay-at-home order, the model is going to look very different. Maybe next week I consider putting something out there. And the logic of that is by next week we will have had 2.5 weeks of the stay-at-home order, and we know that's about what it takes to see if it's effective. And also, we will have been testing 1,000 people a day for over a week, so I'll have a little bit more, confidence in a model, and therefore sharing it more widely.
Okay.
Governor, it's Steve Clampkin. How are you going to spend Easter?
At home with my husband and kids. So in my case, that's very sad because we always have a big Italian feast together. So we're going to watch Mass on television. My husband, kids, and I will stay alone in our house. My brother works the ICU at Kent County, so I worry so much about him. He's taking care of lots of COVID-19 patients. He'll be at work all day. And I think we're going to try to have a family Zoom prayer time at dinner time tomorrow in the evening.
Okay, thank you, everyone, and we will.
Happy Easter, Governor, and
Happy Easter.
Happy Easter.
Happy Passover.
And happy Passover too.
Hey guys, enjoy tomorrow off.